Hi, we're talking about golden milk.
Yes. Well, right now we're in a phase of the program where people are in an intermittent eating. That's the way I like to say it. Intermittent eating. So they wake up in the morning, they don't have actual food, but they start the day with some organic lemon squeezed into hot water, warm water, with a
Right.
little bit of cayenne pepper.
Right.
At 2 o'clock, they break the fast
Right.
with a green smoothie and very specific ingredients, but it's fiber and nutrients and phytochemicals.
Right.
And then within a 4-hour window, they have their meals, which are balanced meals with proteins and good fats. And then in the evening, they have golden milk. So I would encourage you, even though I know that you take turmeric and anti-inflammatories, there's something really good about this, because even after this phase of the program, they continue to drink the golden milk. And at first, it feels like work and everything turns like that color orange yellow of the turmeric.
Right.
But I'm telling you, you got to try it. It's really good.
All right. Just be careful with the curcumin that stains everything.
It does, yes. As a matter of fact, the first thing you have to do is you make this paste, and that becomes the base of the golden milk. Like, you keep it in the fridge.
Oh, okay.
But that comes to a boil like in a moment. Like when it boils, it just goes, and if you're not watching it, because they say a watch pot never boils, it does. I've watched it, it boils. And it happens really quickly. So your whole kitchen will turn orange or yellow if you don't keep an eye on that pot.
Yeah, yeah. Okay.
You ready to field some questions?
I'm ready to field some questions.
All right, here we go. Let's get right into it. I just got over a cold that lasted for about 3 weeks. Sometimes it would get better, then it would come back. I was tested twice, and so was my wife. It was not coronavirus, but I stayed away from people because if I sniffled, they'd freak out.
Yes.
Which you understand, right?
Yes.
I'm fine now, but the weird thing is odors really affect me. I can't walk down the detergent aisle in the supermarket because of the smell. Even the soaps in my house are offensive. I feel okay otherwise, and I have been looking up sensitivities on the internet, but there's too much information, and I don't think I have anything serious. I just think it's weird, and I wonder if it's permanent or just some kind of odd symptom related to the cold I had. Now, I could speak to this at some length from my own experience, but I'm going to leave it to you to handle the medical suspicion.
Well, you'll know if it's more permanent than not sooner than later. What you have is called hyperosmia. It's a hyperacuity of your ability to smell. Some people also have a change in how things taste because most of your taste comes from smelling. You had a virus of some sort. We don't know if it's a cold. You could use a saline nasal spray, nasal wash. There's one called Ocean, and to clean out the nasal epithelium 3-4 times a day. If it doesn't go away within, let's see, 2-3 weeks, if it doesn't go away in 4 weeks, I definitely would recommend that you see an ear, nose, and throat doctor for the nasal endoscopy. I had one of these. They spray some xylocaine up your nose. You're numb, and this beautiful little tube, little black tube, goes up your nose. Actually,
yeah, but it goes in. Doesn't it go like in? Because I remember when I had that done. I'll tell you the story after. But I thought they're going to go up because I thought my nose, you know, you pick your nose, you go up. It went like in. Like, where are you going? Into the center of my head?
Yes. Because
Yeah.
when you go in like this, now you're going down into the eustachian tube.
Ugh, I didn't like
People
it.
have chronic stuffed ears. They'll look in to see if the eustachian tube is inflamed. But they can get up into the turbinates. They can look at the nasal epithelium. They can look at the olfactory epithelium to see if there's something going on. But classically, if it's not genetic or hormonal or environmental, it could come from the virus that you had, which was 3 weeks worth, according to the question, right? 3 weeks.
Right, right.
So I would watch it with a saline wash first to see if that helps. If not, get to the ENT. You need to check that they're scheduling you for the nasal endoscopy before you even get there. Or else what happens is you go there, they go, okay, we'll schedule you for one. Now you have to come back again. And they'll see if there's anything physically going on there. But if not, you know, the worst thing we say in medicine is, I don't know. I don't know why you have that. We see it all the time, but we don't know what causes that.
Yeah, I don't want to go too far down this tunnel, but you know that I got sick from mold. I was misdiagnosed, finally figured out what it was.
Right.
Dr. Richie Shoemaker helped me identify it. I
Right.
got well. Great doctors like you and Dr. Hyman became my friends and allies.
Right.
But after recovering from mold, I went through a bout of chemical sensitivity. And it's really hard. I understand what he's saying, and his is not severe, but it's really hard to explain to people the impact that a smell can have on you. So in trying to seek out an understanding of what was going on with me, I met other people who had multiple chemical sensitivity, and they were debilitated. Part of it is it evokes a fear response. So if there's this invisible attacker that no one else can see, be it perfume, soap, cleaning supplies, you feel alienated. And if you're the only one in the room who's getting sick from perfume, you just want to get away from people. So I'm not suggesting he has it to that degree, but I am suggesting this could perpetuate, and a part of it is psychological. So I like the way you're answering this. It could be part of the virus, not that big a deal. If it doesn't go away soon, go get it checked out.
And if the ENT doesn't find anything, I think you have to look for how your liver is detoxing toxins, because that could be a cause also. If you're not getting that, for people with chemical sensitivities and they're unable to detox toxins.
Now, I know you've met a lot of people with different degrees of sensitivities. Yeah. Was there a time you thought they were nuts, or did you kind of appreciate that what they're telling you?
When I was in the conventional sphere only.
Yeah.
Yeah, because we had to work within a box. And then when you get into the integrated side or functional medicine side, it's not even that the box is bigger, it's that you have to realize there is no box, right? What you have to believe somebody, whatever's working, it doesn't have to be within the box or the cookbook of conventional medicine, because everybody's different.
Has anybody ever compared you to House?
Yes, actually, it's funny you say that, because when we had the stem cell company, we're talking 15 years ago, and we were in Belize, and there's nothing to do in Belize. There's nothing to do in Belize. So as we were there doing the research on stem cells, we were sent the DVDs of House and of Boston Legal and things that I had never seen before. And it got to the point where the staff we would sit around like a movie theater and watch TV, and they would ask me if I could find out, if I knew what was going on before the end of the show. So because
that was good for you. That was a good exercise for you.
Yeah, it was about 85%. I got whatever it was. I mean, the other 15% were made up by script writers. But
but I think that's a big part of the real difference between what we call conventional medicine and the path you took toward functional medicine is forget about the box. Everything is a clue. Like a symptom is not an answer, it's a clue. And you've got to put the clues together.
That was good. That's good, Phil. Everything was a clue.
Yeah.
Right? Not, oh, you feel this, you have that, here's the number, here's the code, pay your bill, next. Right.
Yeah. All right, so on to the next clue.
Okay.
There's something circulating on Facebook that says Fauci knew since 2005 that hydroxychloroquine, I never pronounce it correctly.
Chloroquine.
Okay. Hydroxychloroquine prevented coronavirus, and that's the reason Trump is taking it. So to rephrase it, in 2005, Dr. Fauci knew that this medication could prevent coronavirus. Trump now knows it. That's why he's taking it. Is any of this believable?
So we have to realize that Facebook is two-faced, right? It's a toss-up of what you can believe there and what you can't believe there. One would be, how would you know what somebody knew 15 years ago, unless it was in writing? And two, hydroxychloroquine doesn't prevent coronavirus. It works. Remember when the president said he was taking hydroxychloroquine, further questioning had him say, well, he's also taking the zinc. The hydroxychloroquine, other than its anti-malarial effect, its anti-autoimmune psoriatic arthritis effect, is that as it's an ionophore, it brings the zinc into the cells to fight the replication of the virus. So this is total fallacy. Fallacy, because it doesn't do that. It brings zinc in. Zinc is what is helping the virus not replicate.
Yeah, outside of this forum, do you find a lot of people are asking you about the conspiracy theories? Because again, it's so polarizing and they think that you're going to have every answer. And really, things get sometimes crazy. Where honestly, you have to sometimes scratch your head and go, could that be true? But then you don't know. And I think at some level, you have to go, it's not affecting my world right now. I can't get angry.
I don't care. Move on with something that's important in your life. Stop with the bread and circuses and the here, look over here, look over here. Let me distract you. Let's talk about this. Let's take funding away from World Health now. Right now, we want to. You know, it's all distraction.
Right.
Yeah.
So do a lot of people ask you? Just
a lot. Yes. Yes. Yes.
That's got to be hard because they expect the doctor to have the answers.
Yeah, I try to say somewhat apolitical, but
a friend of mine is taking a capsule that has pine bark and grapeseed, and he says he got it from a guy who was in special forces, and that they took it overseas to prevent viruses. Is this a thing?
Pine bark. So that's pycnogenol.
Pycnogenol
Comes from I think it's God. What is it called? I think it's not Pinus. Pinus pinaster. It's a bark. There's a French maritime bark where it comes from, and grapeseed and pycnogenol. They're interchangeable. You're going to get the pycnogenol from the grapeseed. It has been used to decrease symptoms and length of time of the common cold. It works better if you take it with vitamin C and zinc. And if you took probiotics, you would really knock your cold down by 30% or more. That was from one of the main reviews. God, what is it? The Cochrane review. They took like 30 some reviews on vitamin C and zinc and other things for colds, and they found that actually the probiotic worked better. But there's something to that to help. It's an antioxidant and possibly antiviral. It's not going to hurt you. It could only help you. So it's benign and positive.
Vitamin C and zinc keep coming back in every conversation. Like if there's a list, those are the two that are in every single list. So yeah. It's probably fair to say, because I think, we spoke about this in a separate forum. People expect supplements to work like drugs. They take an aspirin and their pain goes away. So they want to take grapeseed capsule and all of a sudden they're immune. And None of them work that way. But really, it's just building your immune system. And these are all components. So this could be valid, but I don't think it's reasonable to say this is the secret of the special forces to prevent viruses. Yeah, it's legitimate. These are antioxidants. They can also be said to play a role in anti-aging.
Well, remember, special forces have a lot of stress, and they have a lot of oxidative stress. So it's probably a very good idea that these people under a lot of oxidative stress are taking one of the strongest antioxidants out there.
I went to a talk, a seminar, workshop, and it was given by a guy who was in the special ops in Israel and was involved in a lot of terrorist invasions, or they stopped invasions. And he said, I want to show you the toughest exercise that we've had to do. And everybody's like ready for something physical. So he says, choose a partner.
Right.
And look them in the eye and get closer and get closer and get closer. And he has us touching noses. And he says, just stay like that. And everybody starts like laughing, sweating, wanting to get away. And he goes, just stay like that. And he says, when you get to the point that you could stay like that and it doesn't affect you, you now know you can handle stress.
Okay.
So we think, the stress is going to be climbing under gunfire, but he says you have to have the self-discipline to take whatever is uncomfortable and find a level of comfort in it.
It's adaptation. That's how you survive. That's how you thrive, is adaptation. Listen, we're under stress all the time. We know that a certain amount of stress makes you healthier if you have a decent diet and have certain antioxidants. Right?
It's the balance, stress load recovery.
No, that's right. Too much stress, you break a bone. Just enough stress, you build bone.
You want to say hi? Say hi. Just poke your head in. Come on. Otherwise, you're going to think I'm talking to myself. Here's Brooke.
Hi, Brooke. Where's the bird?
Hi, he's over there.
Yeah, bring her over. He wants to see her. All right, let's move on. My father is in his 70s. He's not healthy, and he's on a lot of medication.
No,
He is starting to show signs of dementia, and he sits in the living room and watches CNN all day. Now, that's not healthy.
no, that'll rot your brain. But yeah,
I don't think he fully understands why he can't leave the house, but he gets very anxious. My mother is in her 60s, but she has a long list of conditions and medications too. I'm concerned about them being cooped up for so long. I spoke to the local JCC here in Dallas, and they are starting their senior programs next week. Do you
Okay.
think it's better to take the risk of them being around other people, or is it better to keep them cooped up at home? And she says, I think it's important for their mental health to get out of the house, but is it safe?
So that's a toss-up because they need to get out of the house. Their immune systems will go down the more they're in the house. They need to get out. They need to interact, especially for your father. He needs music. He needs, games, other people. I don't know what their illnesses are, what medication they take, but we know that the more you are quarantined without, sunlight, going out into the fresh air, your immune system will get weaker. So I would say definitely let them wash their hands, let them stay 6 feet apart. There's nothing there about them giving them zinc or vitamin D, which both help fight the virus. So,
Dr. Blyweiss, there are several issues here, and we're going to actually talk about it in answering one of these questions. But, one is, I would guess there's a level of infection or a level of severity, meaning two people can have it and one can have a more severe case than another.
that's right.
The other is the fact of your strength in immune resistance, where two people might have the same exposure and one might get it and one might not, right? So
Yeah.
it's not that we're all equal and we're exposed and we get it and it's
Right.
severe. There are a lot of variables along the way. So what you said is really important. It's not just a question of taking them out to a social setting. It's a question of preparing them so they're best equipped to go into a social setting. And that's where the nutrition and the rest and recovery all play a role, right?
Over the age of 50, we all have something called immunosenescence, which means your immune system is getting weaker and weaker. So unless you're continually supporting it, you're going to reach a phase where you're going to be the one that gets the viruses and gets the bacterial infections. Remember, what did they say? The old man's friend is pneumonia, because that's how we die. You're 90 years old and you get pneumonia and you die because your immune system is so weak. You need to boost it up. And nothing that you said mentioned vitamin D, vitamin C, zinc, silver, anything like that.
Yeah, and stop watching CNN. Watch cartoons or something. Watch old Three Stooges.
I watch comedy. I do Netflix comedy, and I go on YouTube and I watch Dangerfield and Robin Williams. And yeah, I wish people would laugh a little bit. It's going to boost your immune system.
I just saw a really funny movie, if you have this kind of sense of humor. It was Robert Downey Jr. and Zach Galifianakis, and they get stuck traveling across the country together. I can't think of the name of it. Due Date, I think it's called. It's really funny. It's a little twisted, a little dark, but
like
really,
you.
really
Okay.
funny. Yeah,
Okay.
exactly. Actually, it's like there are many movies where you have these two people that shouldn't be together and they get stuck together. There was one with Robert De Niro where he was a bounty hunter and he had to take what was his name? Charles Grodin, who was like an accountant, a rogue accountant, and he had to bring him back.
I
And
remember
it
that
was
one.
just a really good interactive. And then there was the Steve Martin and
Trains, planes, and automobiles.
yes.
Yes, I like that one.
Maybe you and I can take a trip across the country and we'll make a documentary of it. And it'll be really
Wow,
fun.
that would have to be a really big, long RV, man.
Yeah, it's not as funny that way. We have to be in close quarters.
Yeah,
And if we both survive, it'll be something.
that'll be
All right,
Go ahead.
here we go. I like the way this one starts. My idiot brother vapes. I wonder if she has several brothers and this is the idiot one.
Yeah,
Or if she only has one brother and he happens to be an idiot. But my
Right.
idiot brother vapes.
yeah.
A lot. My idiot brother vapes, period. A lot, period. I don't even know what he has in that thing, but it's always with him. I work in a medical wellness center, and many of the staff members volunteered to work at the hospital if we're needed. We had an online education program about COVID, and I think they said people who smoke are not only more likely to die from COVID if they get it, but they're also more likely to get it because they're more vulnerable. Do you think that's true?
I think that they probably said, yes, for sure that will happen. I don't know what's in that vape pen, if it's one of the flavored materials. Remember, we had the huge issue with the vitamin E acetate that they were adding to the flavored vape pens. And what it did is it destroyed the surfactant lining of the alveoli of the lungs. And people, teenagers, were on ventilators. Ventilator story 8 months ago was this. So yes, he's markedly at risk. He's inflaming his lungs. He's inflaming the alveoli. He's decreasing the body's immune ability there in the lungs. And yeah, it's an idiot brother. Sorry.
We talked about you smoking a lot of years ago, remember?
Yeah.
And, you know,
I drink though, because
I
all
have
the
to
other
think
students
back,
were
though.
drinking. I couldn't drink. So.
There was a nightclub in New York called the Heartbreak Cafe. I'm going back a really long time. And there was nothing in there. It was just a big warehouse on Varick Street, except a giant picture of James Dean with a cigarette dangling out of his mouth. And that was the epitome of cool.
That's
right?
right.
That
That's
picture
right.
was the epitome. Everybody wanted to be him in that picture. But why would anybody vape? Like, I can understand the psychology, you know, back in the 50s, 60s, where it was really cool to have that cigarette dangling. Now it looks ridiculous. But the whole thing about vaping, I don't know, maybe it's my age showing itself, but it seems idiotic to me.
It depends what you're vaping. If he's vaping for health reasons, like he was smoking 2 packs of cigarettes a day, he may be vaping the nicotine. If he's vaping CBD or THC, that's another whole thing. If he's vaping a flavor, that's the worst. How do you stop? You just stop.
You know what? But if you go for medical marijuana, that's one thing. CBD, that's another thing. But there are stores where you go to buy vape. It seems
and
crazy.
there's other stores where you give money to buy cigarettes, so you're giving them money to kill you slowly. 7 minutes a cigarette, I think it is. Off your life, 7 minutes. And you're not cool anymore. Listen, I remember at a certain point, we're talking 50 million years ago, where you had a cigarette in your mouth and the pack of cigarettes was in your sleeves that you had rolled up, and then there was one behind your ear, right? You see that I need a haircut here. Well, when it used to be longer, there'd be a cigarette there and the showing your biceps with the cigarette pack. Yeah, it was such a greaser. It was just amazing.
Were you a greaser? Did you actually do that? Yeah?
I used to, I didn't know I had curly hair until
Were you like John Travolta from Grease?
I didn't know I had curly hair until my father stopped taking me to this one barber when I was probably 14, because I used to get a buzz cut. I had no idea. Then I let it grow. Then it did this stuff. Then I had to blow dry it and put my father's Brill cream on it. Remember Brill cream? And yes, there was a short period of time where,
But you're saying the cigarette went with that look. It was it was an accessory to that look.
The whole James Dean look. Yes, I tried the motorcycle once, and with my cousin, but it was at about 140 miles an hour. Got
but
off.
The vaping doesn't even look cool.
No, it looks like that caterpillar on the hook in Alice in Wonderland. You know that they think it looks cool, and it depends. Yeah.
All right. I don't get it. Not that I'm going to get everything. There are many things I don't get, but I don't get that.
Right.
All right. We have one more. And by the way, I told you this before we started. As we've gone through, we started 55 days was the mark. So we're at like 46 days in right now. There were a lot more questions that were really medical because people were really confused. They hadn't heard of coronavirus. All of this was coming out about the supplements. Vitamin C was like as available as toilet paper. But now what I'm finding is many of the questions, and I'm not bringing all of them, are very angry because people are really frustrated and polarized. And I'm not bringing you those questions.
Well, they're also afraid. They're also afraid.
It all stems from fear. It all stems from fear.
And that's media.
Yeah. You know what? I have to tell you that going back when I was a kid, even in school, high school, junior high school, we used to have fights. Guys would fight. And we'd say, I'm going to kill you. Meet me at the mailbox at 3 o'clock. We wouldn't really mean I'm going to kill you. It was just sort of a thing. But now I see venomous social media stuff and YouTube videos, and they go, you should die and your whole family should die, and I hope you all get the coronavirus.
Right, because you have a different opinion.
Yeah, but I mean, it's really you talk about stress, that polarization put on either side. You either go into fear, everybody should stay away from me, or you go into rage where you want to kill everybody. And I think that's the greatest enemy of all, honestly, much worse than the virus.
Yeah,
so,
fear pandemic.
Yeah, come back to center, man.
Control the people. Control the people through fear.
Better to meditate, get in touch with source, be centered.
I found going to the bay every night at sunset, I got a little chair from Costco. And I got to tell you, the half an hour as the sun goes down with this, right?
Yeah.
There's other people doing it. I'm looking at the park across from them, and people are meditating, right? It's lovely. It really is.
Well, you probably started it, and then everybody said the doctor's doing it, so it must be good. And now they're all following.
There you go.
Actually, Jim Beatty, who does a segment in our group called Get Outside, today he was sitting on a boat in the middle of a pond somewhere in Philadelphia fishing with his son, and it just looked like peace. It just looked like he's safe in the world. You know, I mean, we got to get away from the fear. And that's why I go back to the one who says her dad sits and watches CNN. Man, that's almost like putting alcohol in your body. It's just adrenal stress.
I stopped watching news, right? Turn off the news, turn on the music.
Yeah. All right. Here's the last one we have today.
Okay.
I rely on ibuprofin. Ibuprofin, is that how you say it?
Ibuprofin.
I rely on ibuprofin for joint pain in my hips, knees, and wrists. I rely on it. I saw on it says nose, but I'm guessing it's news. I saw on the nose that ibuprofin increases people's risk. I'm ready to switch to something natural, but I tried glucosamine, chondroitin, and MSM, and nothing worked. Is there something natural I can take to replace the ibuprofin? What brand name is ibuprofin?
Motrin.
Okay.
Motrin, Nuprin, Mediprin. So ibuprofen, according to medical officials, does not increase your risk for COVID. It does increase your risk for death through kidney failure, ulcerations, bleeding, anasarca, fluid, heart attacks. I think it's 16,000 people who die every year from taking NSAIDs. So
wait, it does not increase your risk of coronavirus, you said?
Correct. Right.
Okay. So
there's not enough information to say anything like that. What they found is, and again, it's how you look at it, right? It's out of the box, or there's no box. If you're taking ibuprofen chronically, like this person is, and I don't know why they're taking it. They have joint pains. Is it rheumatoid arthritis? Is it simple osteoarthritis? Is it something else? The people who are taking the non-steroidals chronically have other issues. So if this is a psoriatic arthritis or a rheumatoid arthritis, then the autoimmune portion of that reason why this person is taking ibuprofen is the reason why you would be at greater risk of getting COVID. You have to ask a different question. So, I don't know why they're taking it. So they may be at risk because of what their other issues are.
I think it was around 1890-ish that you were able to now buy over-the-counter pain relief in a bottle, right? Bayer aspirin.
Morphine, heroin, yes. Opium, yes.
When Bayer aspirin became available, it was miraculous. You could buy something in a bottle, swallow it, and your headache goes away.
#1 drug in the world at the time. The first $1 billion, the first mega buster drug was aspirin.
Can I ask you this? Do a lot of people really get upset stomach from aspirin?
Yeah, you bleed about a teaspoon of blood if you take an aspirin on an empty stomach.
So whatever year it was, Tylenol came along and they said, we do everything aspirin does. We make your pain go away, but we don't upset your stomach, right?
Yeah, you can ruin your liver with the Tylenol, especially.
Well, they didn't say that, but it was like where everything aspirin is, but we don't have the same problem that they do. We don't upset your stomach.
Right.
So now that became a big seller. And
Yes.
now we're at a point that there's a menu of options and you choose whichever one you like. I remember Aleve was only prescription and then it became available over the counter.
Yeah.
So I think, and I don't know this to be true in this case, but I think in a case like this very often, because there is that option, they don't go to the doctor because they don't want a diagnosis. In other words, I remember somebody said to me, I got diabetes when I was 52. And I said, no, you didn't. And he argued with me. He goes, yes, I did. I said, no, you got diagnosed when you were 52. So in the moment of diagnosis, they suddenly have the label. So many people won't go to the doctor. Like at an internal level, does this person know she probably has arthritis? Yeah, but because she can take the NSAID, she doesn't go to the doctor. So I think people prolong it. And in that, they
Sure.
get progressively worse and there's no symptom, right?
Right, then you really have a diagnosis. If
Yeah.
you had gone to the doctor every year for the full physical, which we really don't do anymore, we would have, and if they did the right tests, we would have seen an increasing insulin resistance. We would have seen an increasing fasting blood sugar, hemoglobin A1C. There would have been other markers that the doctor could have said if he knew, oh, this is the path that you're going down. Let's work on this because you're 38 pounds overweight.
Right.
And, right? So back to the last part of the question for something that's more natural. I told you that I take a lot of curcumin, right? I take 3 of the 500 milligram capsules twice a day. If I don't do that, I do have levels of stiffness and some joint discomfort, but I have none of it with that. But I'm also taking my fish oils, which I think as of last week, we were talking about the SPMs in them that also decrease inflammation from coronavirus. So fish oils are good. Green lip mussels out of New Zealand. I think they work probably because of the level of different omega-3 acids they have in them. But if you're looking for something natural, curcumin, fish oils together. And you should, if you take green lip mussel, all those, you should see something within 2 weeks if it's going to work. But it'd be nice to know why you have those joint pains, right? You have it in the bendy parts of your body. Are there any rashes? Is this psoriatic? Is it rheumatoid? If it is, go to the right doc to clean your gut and clean your body up. Or go to the other doc and get a drug to hide the symptom and drop your immune system.
Well,
Remember
before we wrap it up,
Glenn Fry from the Eagles who died? He
Yeah.
didn't die from his ulcerative colitis. He died from the side effects of the drugs he was taking for his ulcerative colitis that dropped his immune system so much that he got pneumonia and died. And that's what he died from.
I want to give you a little plug and with sincerity. And, you know, I've often mentioned in the same sentence you and Mark Hyman, because again, Mark Hyman introduced me to you.
Right.
But meeting him and then meeting you, I said, these guys are different. The way they approach disease is different. The way they approach cure is different. The way they approach bringing people back along a continuum rather than an instant fix is different than what I've seen in the past. In the past, I've seen doctors say surgery will fix you instantly or drug and then you won't have the symptom anymore. But it was rare and unique to see you guys go, you've moved along this continuum, now we're going to move you back toward health. Right. In essence, you've been trending away from health, and now we're going to implement factors that will trend you back. Yeah. So I'm just going back to this last question. I'm trying to put myself in her position. So if you have so much joint pain that you rely on ibuprofin, right. I do understand you may not want to go to a doctor because they'll give you a label and in all likelihood a drug that you'll be asked to take forever. They don't say it that way, but there's never a reason to get off it because they say you're not in pain anymore, right?
Right.
You need to go to a functional medicine doctor. That's what I would say. Like, yes. This to me is a red flag that she's going, I don't want to keep taking the thing that I rely on. So is there something natural I could rely on? How about going to an expert who could help you get better? And I think that's really important. I think it's a thought process that underlies this whole group, whether it's fitness, nutrition, medicine, science. Right. But I do think people need to get out of that old broken paradigm that is either go to the doctor and get on a drug or don't go to the doctor at all. I think just go to the right doctor.
That's what we've been taught though. Right? Here's the paradigm. Go to a doc, get your drug, and then you won't have the symptom. Meanwhile, the process is continuing getting you sicker and sicker, and you may have to take more of the drug or switch the drug to get the symptom resolved again. What the analogy was, you're driving along and you've got a red light flashing on your dashboard, and it says oil. Wow, okay. Well, instead of going to fill the oil and get an oil filter, you cut the wire to the red light. You go, oh, fine, it's fine now, until the engine falls out, right? So hide the symptom until the engine falls out, or go search a little bit and take a look. Listen, sometimes, and people do expect to get something miraculous done, in a day or two or three by taking a nutritional targeted supplement. But again, there's sometimes when it's too late for broccoli, right?
Things like intravenous ozone, intravenous glutathione, intravenous vitamin C.
Sepsis rates drop double digits with intravenous vitamin C. People who would have died, but are they still doing it? Some docs who have to protect the license because they're going against big pharma.
But do you think on the other side of this crisis, the paradigm will shift, or you think we're just going to go right back to the way it was? In other words, medicine is medicine, they prescribe drugs, and then if somebody is desperate enough or lucky enough to find you, they will.
I think things will change. I don't know how they're going to change it. I do know that even in the company here, things have changed. People are trying to be a little bit healthier. They're eating a little bit better. They are taking consistently certain levels of supplements that they're not getting in their food. Remember, it's a supplement to supplement your food, and our food, unless it's all organic, is a little bit deficient in the vitamins, minerals, antioxidants that you need. So I think there's a slight change. People are going to get out and be together and be a little bit healthier, hopefully a little bit kinder, if things change. And we have political winds here that are keeping people at loggerheads for no other reason than to keep them distracted from what's really going on.
Yeah. So you're playing a role in that. I think, I'd be curious to know, we have, it's over 5,000 people have asked to be entered into this group. I don't know how to track the real number. It stays around 1,500 on the website, the webpage.
Right.
But I know it's more than that. I'd be curious to know, in this sort of micro community, how many people were really infected. I don't know, and I don't think I have a way of knowing, but we really haven't seen a lot of these from people who are desperate and really have it. I remember we had maybe one or two said I had it and I didn't have symptoms, but because these people are learning to take care of themselves. And if there is a paradigm shift, I think that would be the greatest one of all, is for people to realize they've given up their own power and they can take it back. By expecting the doctor to cure you, you have given up that innate power that you were born with.
And your body has to heal itself. You need to come back and reclaim your own health sovereignty, where there's no one that's going to keep you healthy other than you.
Yeah.
As a conventional doc, I never kept you healthy. I
also want to say this, you don't blow your own horn a lot, but I know, and I've spoken to patients of yours, one in particular who was in hospice.
Yeah.
And came back and lived a functional life after that. You know who I'm talking about, or is it more than one?
If there's more than one, I don't remember, but
okay.
I had some of them, yeah.
Yeah, so I'm just saying, even when people are at the point that there's nothing else I can do, you ignited the ability of the body to heal itself. For
as long as it can, right? Yes, I know. The thing that, the example that crops up in my brain is the 90-year-old grandmother of a physician friend of mine. And he brought her in with her nasal cannula and her oxygen tank, that she had severe COPD, and they were giving her weeks to a couple of months to live. And he said, so, you know what? He had been to the lectures. He'd been down to U of M where we gave our conferences. And he said, so, you're my last hope, Obi-Wan Kenobi. So we did stuff, and including the nebulized glutathione. And 3 years down the road, she is breathing without her oxygen. Unfortunately, she now has dementia, but she didn't die when they told her she would and should. Her expiration date was stamped already, and we just changed the expiration date, and she felt better and she breathed better. So yeah. So if nothing else, I hope our talks really change the thinking of people who really thought they're a victim of life.
It's just, this is the card, this is the hand that life dealt me. Take ownership, take responsibility. And certainly if you need a doctor, go to a doctor, but don't let the doctor dictate the rest of your life. The doctor becomes a resource like anything else. And the true healing will come from within. And if the doctor doesn't respect, appreciate, or teach that, you probably need a different doctor. Is that fair to say?
That's fair to say.
Okay.
But medicine's going to change too. We're going to have a lot more telemedicine, and yes, it will change. But people have to change too, and I think we have a good beginning for that. So
you're awesome. We have one more. I'll see you next week.
Okay. Ciao. See ya.
Bye-bye.